When the skull is viewed from above, the overall impression is that of a broad, gently curved dome. This superior perspective is known as the norma verticalis, and it reveals the configuration of the cranial roof, composed primarily of the frontal bone, the paired parietal bones, and a portion of the occipital bone. The most prominent feature visible from this view is the central articulation between the two parietal bones, the sagittal suture. Running along the midline from anterior to posterior, it divides the cranial vault into symmetrical right and left halves. This suture is typically serrated and forms the longest midline joint on the external skull. At the anterior extent of the norma verticalis lies the frontal bone, which contributes to the superior portion of the forehead and curves upward to meet the parietal bones at the coronal suture. The coronal suture runs transversely across the skull, forming a nearly straight line that separates the frontal bone from the parietal bones. Its course defines the anterior boundary of the cranial roof. Posteriorly, the parietal bones meet the occipital bone at the lambdoid suture, which extends laterally and downward from each side of the posterior midline.